But one of the things which I feel like it's so important to talk about, and it might be one of the last things which we discuss, is the fact that we've kind of alluded to this in our conversation right from the start. I mentioned you've been speaking to different ministries of health around the world, and many people might have heard that and thought, a mathematician? Why would a mathematician, not a medical doctor, be sort of interfacing with this world? And that's of course because we are in the midst of a global pandemic, something which the world has seen before, but not in this age of people flying globally around the world, of the internet and of the technology that we've got. And I don't know about this and your experience, but I've certainly found as the coronavirus has spread, in terms of what everyday people are absorbing from the world around them, there hasn't been a time where we've seen as much mathematics incorporated into just a news report. We've been seeing graphs with logarithmic scales. We've been talking about percentage infection rates, false positives and false negatives, all that kind of thing. Pool testing and how that works, and in fact, the wonderful mathematics underneath it. But one thing that's been hugely important has been contact tracing. Now, I guess I'm interested in, contact tracing has been something that we've now sort of added into our lingo for how we fight this disease. But I'm interested first, before we talk about what you and your team have been working on to help solve that problem, why is it so important now? Why is contact tracing, like when we fight other diseases, we don't always think about it in these terms? Can you help us understand why this is such a powerful tool and what mathematics has to do with it?
Yeah, so I'll give you an answer that a mathematician would give, because what we try to do is as mathematicians, we always try to figure out what is different. Like in mathematics, you have a few assumptions, and from those assumptions, you draw a conclusion. How come suddenly this disease is different from the others? I would isolate that one of the key aspects is that it transmits before you know you have the disease. The fact that you start to become highly contagious 2 days, 48 hours before your symptoms start makes this a very, very difficult disease to control, because it makes it so you can't use our natural human instincts. Normally, the way we do something is, I feel like I have a fever, or I have a runny nose, I won't go into work today. That works great as long as the disease only starts spreading then. But if the disease starts spreading before then suddenly the problem is that you have people running around, getting other people sick, finally realizing that they're sick, maybe at that point doing something, but it's too late, some other people got sick, they're running around, they get more people sick, then they find out they're sick, then they go back in, but it's too late and the exponential growth takes off. So if I were to boil it down, I'd say the very unusual thing is the high amount of contagion before you know that you have it. Now, that contact tracing component, the way the rest of the world has been trying to attack this, is they've been trying to chase as fast as they can. Because if you go and find out that there's somebody who had it, it's actually very natural and logical that you go and try to see who were these people around. Can we intercept them and quickly rein them in? Because maybe that would control the virus. Not maybe, it does work. There are countries which have used this to great success. And so I think that's why contact tracing became a thing.
So that makes a lot of sense, because it is a transformation of the problem, isn't it? Which I love. It's just it's a keystone mathematical problem-solving strategy. But you're right that even though, we have measures that do work, of course we're saying if you are sick, definitely do stay home. But because of this nature of the problem where, before that happens, actually we've already got this spread. And as you were alluding to before with networks, we live, especially, around the world now in our cities, in such incredible density. And so in some ways, even though usually being in a city, brings significant advantages. You have access to all of these things very conveniently, but right now it's kind of working in the opposite direction. The closer you are to other people, the more struggles there are. And so that's why, you and your team have devised this kind of different contact tracing app that takes a very different approach, and it's called Novid, which I love. Obviously, we've already seen from XP, you have a penchant for fantastic and memorable names. Novid, not COVID. Can you tell us, how does this app work? Why is it different?
So that's where the network theory comes in, right? So I actually do think about networks all the time. And when COVID broke out, it's very interesting. Actually, the last person that I had a serious mathematical conversation with about education was in fact you. I saw you in Australia, and that was right before a lot of these restrictions shut down. And as I was getting back into the US, that's when behind me, basically doors were shutting of all the places I'd been before, they were shutting down. And at that point, I started to think, is there anything I can do to try to help with this problem? And I realized that due to the fact that this disease is spreading before you know you have it, then maybe I can try to do something with network theory. But after thinking about it for months and months and working on various versions of apps, we came up with something that is completely different from this traditional catching up method. In fact, we actually would even consider it to be a paradigm shift. And I'll say this in the framework of network theory. Normally, what happens is when there's somebody who's infected, the normal contact tracing apps and the normal contact tracing method will go find everybody who was directly exposed. Those are the neighbors of that node. And it would ask all those people to please quarantine and please isolate. Unfortunately, that actually hasn't worked so well. We came up with something else. We said, what if for every person who is positive, who's infected, what if you told everyone else how many relationships away that person was? Don't tell them who it is, but this is the transformation, right? We're not going to just report true or false. Were you exposed? We're going to tell everyone, you were 7 relationships away. You were 2 relationships away. Well, what's the use of this? The value is, first of all, what's a relationship? A relationship, if you use an app, like we actually made an app for this. A relationship is measured by 2 people actually being in about the same place for at least 15 minutes. So that's how we make this network, right? We build this huge network that's in fact a worldwide network. And then what happens is if you want to know what's your relationship distance, you just count how many steps. It's almost like if I'm here and I know somebody, if I'm here and I spend time with somebody who spends time with somebody who spends time with somebody who got COVID, that would be a distance of 3. But the reason why this is useful is that you can then animate this like a weather radar chart. You can actually animate a bar chart which shows how the disease is approaching to you, and you can use that to directly avoid getting sick. Because with this tool, if you can see the disease coming towards you, it gives you a new way for all of humanity to fight contagious diseases. Actually, that's the thing that is most amazing to me at this point, that in this year, 2020, it could be that we have come up with a totally new tool for humanity to fight any disease that spreads through person-to-person contact. The tool is radar. And the right way to measure your radar is to use the network distance. Because it's not useful to say, there's a COVID case over there 20 meters in front of me. The reason that's not useful is usually that person doesn't even know they have COVID. So how would that even work? There's no way to do that. If they knew they had COVID, they wouldn't be standing there. The problem with COVID and all these other diseases is that you don't know you have it. So a radar should not be based on meters. Instead, the right way to do the radar is, how does COVID get to you? Oh, it gets to you from someone you spend time with. How does it get to them? From someone they spend time with. This is where the network theory comes in. So that's where, since I was a network theorist, I said it's very simple. For every case, just report the network theoretic distance between that case and you. But suddenly, if you've got this app, you are empowered to protect yourself. Because we've asked a lot of people, what would you do if you saw the disease closing in? People said things like, oh, I would make sure to wear a very good mask, maybe even an N95 mask that protects me more than the typical cloth masks. Or maybe if I'm in public with other people at my workplace, I might keep more distance than usual, not just the 2 meters. Or if I have the opportunity to, I might choose to work remotely. But I'm just explaining that there are all these different actions that you can take to do something to protect yourself. And if you just knew that something was on its way in, you could defend yourself against the invisible disease.
I think one of the things that I so love about this approach is that it takes, number one, a tool that we wouldn't necessarily think about as one that's like, oh, that's something that has a direct connection to medicine or health or indeed anything necessarily very practical. But actually, because of the nature of the problem here, it's not just a medical problem. As you pointed out, it's an information problem. And I think this sort of gets to the fact that so many of us, our response to this pandemic has been significantly coloured by, do we know someone, do we personally have knowledge of someone who perhaps has gotten sick or had a relative who has, and so in fact we are still using that strategy as it were, but in a very, very weak form, because we have to be reliant on, well, did that person definitely and did they get very sick, and in fact we're reliant on the fact that all of that is non anonymous. We have to know these people personally before any of that knowledge is transmitted to us. But COVID doesn't care if you know people personally or not, it will spread regardless. And so that's actually a key part of the app and how it works, right? That there's this anonymous aspect to it. Could you talk us through a bit of that mechanic and how that applies to the app?
Yes. So when people were talking about contact tracing back in, say, March, that was a very non-anonymous form of somebody calling you to say, who were you around? Where did you eat dinner last night? And they were doing it with names. And my observation was, as a network theorist, COVID doesn't care who you are. COVID just cares that these two people were near each other. And so all you really need is a way to figure out with pseudonyms without knowing who a person really is. If you install the app makes up a random pseudonym for you. It's actually a 128-bit number, which is about a 40-digit number, approximately, but like some very long number that represents your identity without actually representing your identity. No mobile number, right? So the way that we built this is if you install this app, it doesn't ask you for a mobile number, doesn't ask you for your residence ID number, doesn't ask you for anything. It just makes an ID for you. And then as you're wandering around in public, if you happen to have the app and somebody else has the app, then the two discover that, all right, these two random numbers were near each other. But since we intentionally don't want to know anyone's identity, all we do is we build up this big anonymous network. And the observation was, you know what? If these anonymous participants could just find out that there is a wave of incoming COVID towards them, where you tell it to them in ways that also protect the anonymity, like it's at distance 4. How many people are at distance 4? Maybe there are 20 or maybe there are 30. I can't tell who it is, but it doesn't matter. It's at distance 4. And once you get this information, the natural outcome would be, it's very interesting, the natural outcome would be that around everywhere that the disease was, people would start to freak out in a good way. Freak out in a good way of trying to defend themselves. But there's another thing about the math here. The act of defending yourself from getting sick is symmetric. It also prevents you from getting anyone else sick in case you were an asymptomatic or pre-symptomatic spreader. So again, this is the math part, the geeking out over here. It's that somehow, if you actually had an app like this, here's what you'd actually see. You wouldn't see a national lockdown. You would just see that wherever the disease went, around that disease, out to maybe 3 social circles, people are making themselves scarce and reducing the spread of the disease. In fact, stamping it out. In fact, maybe in your book, if you have any discussions of convergence, this is basically a dynamic process which causes the number of cases to converge to 0. Because wherever it is, there's a natural pressure to reduce the amount of action, amount of interaction, and that stamps out the cases. The reason this is so important is because the way that we traditionally as humankind are trying to fight diseases is the opposite. We aren't converging to 0. We're converging to cases. Because whenever there are fewer cases, we release. And then people start to move around more until there are too many cases, and then we lock down. The math of this is that you're guaranteeing to converge towards always having cases. Whereas the difference in what we're doing is that you might not need to lock down everybody, but there might be around that one case 10 people who are freaking out. And by freaking out, there's no more spread. And then there's no more one case. So this is actually what I'm really excited about these days, about how you could use this network theory insight on math to go and make a totally new intervention, a totally new type of tool, which can be used alongside every tool we use to fight disease, but could be as powerful as a radar in stopping the spread of disease.
That is incredible because, like you said, as you were mentioning before, we have this rhythm of, cases rise, so then we act, and then, if the action works, then cases drop, but then we necessarily relax because, the economy is being affected and so on. But there is going to be this rhythm established, this equilibrium, which by necessity has some cases around because it is a reactive solution. We respond once we see the cases, so they're already there. Whereas this is it almost allows for a forecasting situation. As you mentioned, as you're watching the numbers, the relationships, perhaps it starts at 7, then it goes 6, 5, and 4, and then you realize, I can actually respond to something I see coming before it actually arrives. And that's what changes the dynamic so wonderfully, right?
Yeah, actually, this is where I think about all of these things of what is different here, right? And there's another thing that's very different. Once you can see it coming with a longer range distance, for the first time, the app gives you a direct way to avoid getting sick. Whereas if you compare with the other apps that, say, Google and Apple have been building systems for, those apps are all designed in ways where it doesn't tell you anything until after you've already been exposed to somebody else who's positive, and then the app tells you, please quarantine. Now, this is very different because at that point, there's no more time to do anything to protect yourself from other people. The ask is, please protect everyone else from you. And this is where game theory comes in. Actually, this is another very interesting angle. There's a notion of what's called a Nash equilibrium. A Nash equilibrium is what happens, it's a state of affairs where nobody has any incentive to deviate. That's one way you could call a Nash equilibrium, all right? And you can even think of this in terms of human behavior. It's like, could we say, let's all agree on the following strategy? If it's in equilibrium, then that would mean that nobody has incentive to cheat. But you see, in that app that I've just described, the way that Apple and Google are making their system, imagine everyone was using it. You would have plenty of incentive to uninstall. Because if you uninstall, everyone else is still protecting you from them, and you don't have to quarantine. I'm actually saying this is bad behavior, this is selfish, don't do that. But the unfortunate thing is that the selfish equilibrium for that system is actually nobody installs it. Whereas what we've done is we said, let's not try to drive any quarantines with this app. Let's just, instead of calling it quarantine, of protecting everyone from you, give you enough foresight that while you're busy buying enough toilet paper for the next 10 years, because everyone will do anything to protect themselves a little bit more, this is true, while you do that, you effectively cause all of the impact that was wanted, except that you actually got to protect yourself. And then the Nash equilibrium here becomes, the equilibrium becomes that everyone installs it. It's actually, once you make it so that it satisfies the following mathematical property called installing app decreases your chance of getting COVID. That is actually the property that ours has. If you install the app, you decrease your chance of getting COVID. Surprisingly, that is not what all of the other apps had. They had the property that if you install it, you decrease other people's chances of getting COVID, while you increase your chance of getting quarantined. So these are the sorts of things that we think.
Yeah, you were referencing before some massive ideas there. You know, game theory, for example, is an area of mathematics that many people, sort of your average person on the street, has never encountered during their school experience. But what you mentioned of the fact that we are all, in a sense, we have this natural inclination toward selfish behavior, towards self-protective behavior at potentially the expense of other people. This is something we experience all the time. I mean, I think about, in another lifetime when we were, in airports and perhaps we'd just gotten off the plane and, there come our suitcases off the carousel and we're all there standing around waiting. And as soon as the suitcases begin, what would make sense? What would be helpful to everyone is if we all stood back so that we could all see clearly. And then once you see it coming along, you say, oh, well, now I will move forward and collect my suitcase. But in fact, that is not the equilibrium that actually occurs. Everyone gets in as close as possible because it gives you an incentive to be able to get to yours faster. It creates a problem for all the people behind you, but then, what will they do? They'll then move forward and then suddenly we're all in the crowd and everyone pays. And I guess we're in a very similar situation here where the technique that we use for contact tracing, if it is something that is clearly going to give me a benefit, it obviously is going to have a much bigger chance of success. And that's just human psychology as well, isn't it?
Yes, and that's why I guess I had the idea that this should be possible because there's so much good created by having done the right thing. Because then there's less disease, there's an economy that runs, there's no shutdowns. This is exactly what we want. So as a mathematician, you try to say, if there's this much good, could we find a different way to apportion the good? Do you know what I mean? And so that's why when you use the network theory to give that forewarning, that suddenly apportions enough of the good to encourage a person to use the system, that they then use the system. And since there was so much good to go around, the pie is big. So you can actually make it so that every participant got what they wanted. And everyone got to a better place. Whereas the problem was what people were trying to do before with apps. The good was apportioned differently, where it was good for the government and good for everyone if everyone collaborated. But unfortunately, on the point of view of the individual, it didn't deliver what they may themselves have chosen to do. So that's what I'm actually right now really trying to push, because it's actually quite rare that an idea like this does arise. I mean, one would normally expect that ideas like this, you've already seen them all. It's the year 2020, right? But I often think, how could something like this be new? Well, it might be because this requires lots of smartphones. And this is the first pandemic we've ever had where there are lots of Bluetooth-enabled smartphones, where you could basically turn every person into a person who can defend themselves against the disease.
It's this generational leap where not just we have technology, but actually it is ubiquitous, and that's what enables this particular strategy to work. Po, I think this is so brilliant, and I think it is something which I hope governments around the world are going to pay attention to, and they're going to realize, wow, this is actually a very clever, ingenious, and effective way to actually fight this disease. Po, you've been so generous with your time. Thank you so much for spending today with us. Good luck as you speak with all of these different people around the world and try and help them to see all these different strategies for attacking this disease and hopefully overcoming it as well. Thanks, Po.
Well, thank you, Eddie. It's a real pleasure talking to you again. I can't wait until I can see you in person again, back when the world's back to normal.